Hello and welcome to all to this very special initiative on World No Tobacco Day. 31st of May every year is recognized as World No Tobacco Day. This day is recognized to spread awareness on the harmful effects of tobacco, whether it may be smoked or smokeless forms, and also making people aware about the different health effects that smoking can cause, and understanding the link between tobacco use and lung cancer risk. This is an initiative by Roche and is supported by Integrated Health and Wellbeing Council. I am your host for this session. I am Dr. Asavri Sawant, Public Health Specialist with IHW Council, and we have a very eminent expert here with us. We have Dr. Aparna Sreevatsa, who is Consultant Medical Oncologist at Nanjappa Healthcare, Shimoga, Karnataka. Ma'am, we welcome you to the show.
Thank you. I'm very excited to be here.
Yes, ma'am. And same for us. So let us get started with clearing out the air, busting the myths around this topic. So, ma'am, our first question to you is, we would like to know how big this problem is of consuming tobacco in India. How many people are suffering from it? And in your practice, what has been your experience?
So tobacco is an important healthcare concern for India, as the Western population is moving away from tobacco. They have understood that smoking is bad and they are moving away from tobacco. But we started mimicking the Western population. We started imitating them and started smoking. And we are yet to understand the magnitude of the problem. And according to many surveys, it is seen that nearly 25% of Indian population is addicted to some form of tobacco. It may be smoked or smokeless. So it's a major health burden, and as we know, it causes multiple problems, but it's a very strong addiction that people get addicted and they find it difficult to come out of the situation.
So our next question to you would be, what types of cancers or different diseases can be caused by tobacco use? Can you please help us understand that?
Tobacco is a carcinogen. We know that the tobacco smoke has nearly 150 chemicals which can affect us, and it's a slow poison. So many people say that I have been smoking for 10 years, 15 years, and nothing has happened to me. So it is a slow poison. So it may take 10 years in one person, it may take 20 years in another person. So what do these chemicals do? They damage the cells of our body. So the cancers which are tobacco related are directly related to the route of administration. Suppose the patient is chewing tobacco with the mouth, it causes, wherever the tobacco goes, it causes problems. So it causes cancers of the oral cavity, tongue, throat, food pipe, the esophagus. It causes cancers of the stomach, pancreas, and kidney. And when we come to the smoked tobacco, when we smoke tobacco, it causes the nasal cavity, the throat, then lungs, and it gets absorbed in the blood also, and it can cause blood cancer, uterine cancers. So what happens is, these chemicals, they keep damaging the cells of our body. So just like how we have our brain controlling our entire body, every cell has the DNA or the genes which are important for the functioning of a cell. So they cause damage to our DNA. They hit right at the heart of the cells, and they cause damage to the DNA, which causes mutations. So these mutations make the cells immortal. They go on on dividing, they go on multiplying, and they form a tumor or a swelling. When there is a uncontrolled cell division, the cells keep dividing, they never stop, and that forms a cancer. And not only that, the cancer grows in the mouth or throat, but it can spread to the entire body, and that's what is different about cancer. It has the power to spread to the entire body and damage our cells.
Thank you, ma'am, for so nicely explaining us that. You not only answered our question, but also helped us understand how does tobacco causes cancer. So let us take up all the different cancers that you highlighted one by one, so that our audience also understands how grave this condition can lead to if you do not stop tobacco completely. So can you please help us understand what is lung cancer?
Yes. So before that, I would just want to add that this smokeless, though the theme of the day is clearing the air, so somehow we have been able to clear some air because there are some no smoking zones, and smoking is considered bad. But the smokeless tobacco is a very important burden in our country. And many people, if you take the rural and urban population, rural areas are very high consumers of smokeless tobacco, this gutka and the smokeless tobacco, and they don't understand. It is like their culture, it is there in their tradition. Along with betel nut, they will have tobacco also. And unfortunately, many of the celebrities also, they endorse these kind of products, and I think that is adding to the problem of the smokeless tobacco. And if you see men and women, we don't see so many women smoking in our community, but smokeless tobacco, women are a very important consumers for smokeless tobacco. So it's a very important. So not only lung cancer is important, this cancers of oral cavity, throat, these head and neck cancers are an important burden, especially in rural areas. And I think this initiative should also help people understand that smokeless tobacco is also very important. So coming to your question on lung cancer. So lung cancer, nearly 50% of the lung cancers are smoking related, and it is seen both in men and women. And there is a type of lung cancer called small cell lung cancer that is exclusively seen in smokers. It's a very bad and very aggressive cancer which is exclusively seen in smokers. So it's very important that we understand that smoking is an important cause of lung cancer, and everyone should make it a point to understand the magnitude of problem with smoking causing lung cancer.
Ma'am, can you also please help us explain, understand how lung cancer is detected, and the different diagnosis of lung cancer, how it can, how the treatments have improved through the years, so that in this day and age, if somebody is suspecting themselves to have some sort of abnormality, how can they go and get checked?
Yeah, it's a very important question. So when people get diagnosed with lung cancer, they say that, oh, I had this cough for nearly 5 months, and I never realized that it could be cancer. So what happens in smokers is that they're smoking every day, and they get some sort of that irritation because of the smoke causes some cough. It is called smoker's cough. So they keep coughing every now and then, and the family also, they are like, okay, he smokes, so he gets the cough. So they ignore that cough. Okay, so what happens is that the tumor, the cancer which is growing in the lungs also can cause cough. And when should a patient get alarmed about this cough? If the cough is lasting more than 2 weeks, then that is the point they have to consult their doctor. So what happens is, you go to the doctor, they will ask you to quit smoking, try some antibiotics or anti-allergic medications. months and the cough is not going, it is persistent. So any persistent cough, you have to be very careful. And usually doctors ask them to get a chest x-ray. So the patient, they feel that I'm very healthy, I'm going to my office, I'm doing all my work, do I really have some problem? So that's the problem with cancers. So cancers, they remain silent for a long time. And if we see the data in our own hospital also, nearly 75% of patients with lung cancer get diagnosed in very advanced stages when cure is not possible. So we should make every smoker has to keep it in their mind that a persistent cough lasting more than 2 weeks has to be addressed by a doctor, and you need to do scans. Maybe you have to do a chest x-ray, and if chest x-ray is not showing anything, because chest x-ray is a very crude way of diagnosing things. If there is something big, we will pick it up in chest x-ray, otherwise we may have to do a CT scan. So sometimes in our country, tuberculosis is another problem which causes chronic cough lasting more than 2 weeks. So a chest x-ray may not differentiate tuberculosis from lung cancer. So in such cases, we ask the patients to get a CT scan, and CT scan is a must if you are having other problems of lung cancer. Say you are having blood in cough, when you are coughing up blood, or you're having shortness of breath, you are having chest pain, or you are losing weight. Sometimes patients will also be trying to maintain their body weight, and they're doing some diet and exercise, and rapidly they start losing weight, and they think that it is because of the diet they are losing weight, but sometimes they may have a lung cancer which is causing the problem. So an appropriate imaging modality like maybe a CT scan is always important. So for all these, you have to go to the doctor. These days, what we do is we just Google our symptoms, cough. So you'll get 100 diagnoses. We'll choose the most innocuous. Oh, this is allergy, and we treat ourselves with home remedies. So it's very important that you go to the doctor. Take your health as a priority. You take leave for one day, go to the doctor, get evaluated.
Definitely, ma'am. Rightly said that it is better to go to doctor and get checked if you are feeling any of the signs that have been listed over here. And if you are consuming tobacco, whether it may be smoked or smokeless form, do not ignore your health condition at all. And, be alert if you are having any of these symptoms that have been shared today. Get yourself checked. That is the best way to go about it. So, ma'am, we were talking about lung cancer in detail. So, how many people are affected by lung cancer in India? What are the estimates approximately?
So lung cancer is among the top 5 cancers in our country, and also globally it is even ranked even higher. So it is like the second most common cause of cancer in the global scenario. And in India, it is among the top 5 killers of cancer, because many other cancers like breast cancer, they survive longer compared to lung cancer. So it is not only that it is more numerous, more people are getting affected with lung cancer, but they are also surviving lesser. Like their survival rate, if you take the 5-year survival rate, suppose patient gets diagnosed with cancer today, so in 5 years, how many would be alive? So it is hardly a handful, like 9 to 10% of patients are alive at 5 years. So it's a very aggressive cancer, doesn't give long. It is getting diagnosed in later stages, terminal stages, when we are not able to offer cure. So that is the magnitude of problems with lung cancer in our country.
Definitely, ma'am. Very rightly said that most often lung cancer get ignored till the very last stages, and when it gets detected, it is too late to reverse or completely cure. So, on the same note, that makes it more imperative and more important to create awareness around lung cancer. What is your opinion around this?
So the awareness is very extremely important, and it is better that we catch these people young, and the youngsters should be motivated to learn about the problems with tobacco. And it is seen that if adolescents or youthful people get addicted to tobacco, it is very difficult to quit tobacco. So that we have to create awareness, and in a family it is very important that parents set a role model. They should be role models, and they should teach their children that it is very bad to get addicted to tobacco.
Thank you, ma'am. So symptoms of lung cancer can vary from person to person, right? And there could be a possibility that the person might not have any symptoms at all, and just simple bad cold or is a bronchitis, for example, and that could not get better for long duration. So just to make our audience understand the different symptoms around lung cancer that can be, can you please help us list down all of them?
So I can tell you all the the symptoms and signs of lung cancer, but cancer is a very witty disease, and it remains silent. It's like a thief. When a thief comes to our house, he doesn't knock or ring the bell. He'll remain silent for a long time. So it is very important to understand that it can remain silent. That is one thing. So coming to the signs and symptoms of lung cancer, a cough lasting more than 2 weeks, breathlessness or shortness of breath. You are not able to climb the stairs. You are feeling breathless when you are doing any unaccustomed activity, which you are doing okay earlier. And having a chest pain, and losing weight, any unexplained loss of weight. You are not able to eat food properly, and sometimes they get this shoulder pain, pain in the hand, and that is all if the lung cancer is restricted to the lungs. Sometimes what happens is the cancer silently spreads to other parts of the body.
Thank you so much, ma'am. So, ma'am, earlier, as you were saying that X-ray, it could be difficult to detect, lung cancer from tuberculosis by simple X-rays. So, we would like to understand what are the different ways in which lung cancer screening can be done. What are the different options that are available, and what do they usually do in brief?
Yes. So when patients are having symptoms, we will evaluate them anyway. That suppose patient is having cough or blood in sputum, we will do a chest X-ray. If we are not able to find out, we go for a CT scan. But we with this exercise, we will see that most majority of the patients, if we diagnose it after they develop their symptoms, nearly 75% are already advanced stages. But we want to catch them at an earlier stage when the cancer is silent. So I'm a healthy person. Suppose I'm a smoker. I have smoked for 10 years. I have become aware that do I have a cancer already growing in my body? That is the scenario where we do a cancer screening. We want to be one step further from the cancer. So we want to catch the cancer at early stages when it is still growing and not it is silent. It is not causing any problem. So what happened in COVID era was that whenever patient is COVID positive, we used to do CT scan to see the severity of the COVID infection. So in that era, we found so many lung cancers which were silently growing, and we detected many patients in early stages where we offered even cure to the patient. So the philosophy is the same here. Suppose there is a patient who was a heavy smoker and he wants to go for a lung cancer screening. We do a low dose CT scan which can pick up cancer which is silently growing, not causing any problem. So because the dose of the X-rays or the dose of radiation is very low in this CT scan, it doesn't harm the patient, it doesn't harm the person, but at the same time, if he is harboring any silent lung cancer, usually we pick up cancers at early stages if we do a low dose CT scan. So this is recommended for all those heavy smokers who have smoked more than 10 years and they want to be aware, they want to detect lung cancer in early stages.
Thank you so much, ma'am. And ma'am, in our time when we were practicing in dentistry, dentists are also the first people mostly to detect cancer, because they are touching your palate and your cheek muscles. So if there is hardening of the tissues in your cheek area, so that is also one of the signs of that the person is consuming excess smoked or smokeless forms of tobacco. So ma'am, as we were discussing all these advanced screening methods that are there in India, what are the barriers to lung cancer screening that you in your experience feel that are still persisting?
So the problem in India is that we are not aware. Usually the healthy individuals, they are slowly getting aware about the obesity and need for exercise and cardiac problems. They are understanding, but the problem with cancer is that they are not aware of the screening methods. And the other problem is that there are a lot of barriers. So what are these barriers? To get a chest x-ray, you have to have the x-ray machine. So just imagine a rural population. I practice in a rural area, and there are so many villages where x-ray is not possible. To get an x-ray, the person has to travel 100 kilometers. So a person who is sick, they come because they are having problems like chest pain or breathlessness. They travel 100 kilometers and they get evaluated, get a chest x-ray. But a healthy person, they don't feel that it is important to travel all the way to get the screening test. So I think that is the need of the hour. So our government is doing all that it can for cancer treatment. So every government is taking an initiative that we will provide cancer treatment, but we haven't gone to the stage where we are going for a preventive methodology, and prevention and screening is lagging behind because all our efforts, all our funding is for cancer treatment. So I think maybe in the years to come, the government should provide infrastructure. See, we are talking about low dose CT thorax. So to get the CT scan, we need centers which can do CT scan. So that we have to strengthen our infrastructure, sensitize our team, and create a protocol for screening healthy population, and then only we can take a step ahead of cancer.
Thank you so much, ma'am. And definitely in years to come, and with all these awareness initiatives that we are doing every day, the enough attention would be created, and enough, people would be made aware so as to prioritize this aspect in cancers as well. So earlier you were mentioning that the small cell lung cancer is very aggressive. So on the same note, we wanted to know what are the different types of lung cancer.
So if we see the lung cancers are divided based on how they look under the microscope. So usually any cancer is diagnosed on the basis of a biopsy. So what we do is, there is a cancer swelling. We take a small piece of it in the form of a biopsy. We examine it under the microscope and see how it looks. So based on the cell shape of the cell and based on the cells we see in the tumor, we divide the lung cancer into two major types. One is small cell lung cancer and other one is the non-small cell. It is not a small cell, maybe big, maybe they are different in size. So the small cell lung cancer is a smoking exclusively seen in smokers, and it is very bad. Most of the patients would have already spread to the brain and bones and things like that. So these non-small cell lung cancers can be of two types. We call it one is adenocarcinoma and the other one is squamous cell carcinoma. So in this non-small cell lung cancers, it is very interesting to see that the smokers and non-smokers, they behave differently. The smokers usually have a very aggressive disease. They don't respond to the treatments well, whereas this adenocarcinoma, usually it is seen in non-smokers and women, and they are easier to treat. Such patients do better compared to the ones we see in smokers.
Thank you so much, ma'am. We also wanted to understand what is lung cancer staging and what does that mean?
So any cancer, the first question the patients ask is, what is my stage? What are my chances? So as I told earlier also, cancer as it grows, it slowly grows and becomes bigger in size. The tumor, the main tumor is called the primary tumor, and it spreads. So how does cancer spread? Usually they take the help of lymph nodes. From the primary tumor, the tumor spreads, the cancer spreads to the lymph nodes, and it also uses the blood vessels. So cancer has to grow bigger, right? It has to keep dividing, become bigger in size. So it makes, it takes the help of blood vessels and makes pipelines for its nutrition. So as it is connecting with other blood vessels, it goes and seeds the whole circulation system. So through blood, it spreads to different parts of our body. So based on this spread, we have a system called TNM staging. T is tumor, N is lymph node, and M is metastasis. So when the tumor spreads to the entire body, it is called a metastatic disease. So based on this tumor, lymph node, and metastasis, we divide the lung cancer into different stages. So usually in general, first and second stage of lung cancer, the lung cancer is restricted to the lungs. It hasn't spread, it is not widespread. We can offer curative treatment, we can offer cure. If it is third stage, it has already gone to the lymph nodes, and we may not be able to cure it. And if it is metastatic, if it is stage 4, it is not usually not curable. But that does not mean that everyone who is diagnosed in stage 4 will die. It's not like that. With the advancements that we are seeing in oncology, even with the stage 4 disease, patients are surviving for 5 years. We are even seeing patients surviving for 7 years. So it can very well be controlled, but we have to take a longer treatment and lifelong treatment and keep it under control.
If you can just explain us in short what all different things that lung cancer treatment entails.
So any cancer, the treatment depends on the stage. So if we are detecting lung cancer, as I told you in COVID times, because of rampant CT scans, we diagnose just there is one small tumor in the lung and nothing else. It is just starting to grow. So in that case, we can do surgery. We can remove that part of the tumor. And if it is if patient is not eligible for surgery, suppose patient is very old and not wanting surgery, we can give radiotherapy also. So radiotherapy is using high dose radiations in the form of similar to X-rays. They are invisible rays which can be given. They burn the tumor inside the lung. So there is surgery, there is radiotherapy, and sometimes you can add on chemotherapy after the surgery is done. Sometimes we have to give chemotherapy, and this is in early stages, stage 1 and 2. We can use all these 3 modalities: surgery, radiation or chemotherapy and control the tumor. Sometimes it is stage 3, and in stage 3 we may have to combine chemotherapy and radiotherapy together and treat the tumor. And these days we also have this very important modality called immunotherapy. So as we discussed earlier, cancer tends to it depresses our immunity, and patient will not be able to fight the cancer. So we have many medications which are immune boosters. They boost the patient's immunity so that his own soldier cells will go and control the tumors. So even in stage 3 we can combine to chemotherapy and radiotherapy. We add on immunotherapy and it gives a very long lasting response. And as I said, 75 to 90% of patients get diagnosed in last stages, and the moment they hear last stage 4, they get very depressed. But I tell them, see, times have changed. So if you see last decade, so many medications have come up. There is targeted therapy, there is immunotherapy. They are such good drugs, and they give very long lasting durable responses when they are used in the appropriate patient. So even if you are diagnosed in last stage, please don't lose hope. You consult an oncologist, and you discuss what options are there.
Thank you so much, ma'am. On the same note, our very last question for you today would be, there are some people who feel it is too late to quit smoking. So what would be your advice for them? And if you can give some tips for stopping smoking.
Yeah, many patients they tell me that they are very depressed. They have lost all hopes, and they tell that, okay, now that I'm having a cancer growing in me. What's the point of leaving? It's okay, I want to continue. But if you see the mechanism of tobacco related damage that happens in a body, it is seen that if you quit tobacco now, in 30 minutes your body starts to heal. Your heart rate will come down, your hormone, the chemical storm that is going on in your body tries to stabilize, and in many days the damage in the lungs, the healing process has started, your immunity is boosting. So even after diagnosed with cancer, there is a point in quitting tobacco. And many patients, they find it very difficult to quit. They say that, yeah, I want to quit, but I'm not able to quit. It's such a strong desire that I'm not able to quit. So if you are having such problems, you please consult your doctor. Tell them, they feel very ashamed to discuss such things. So it is very important that the family should support such people. And I always tell them that you make a group, you take the help of your family members, and they should always be supportive in a positive form, in a positive reinforcement.
Thank you so much, ma'am. And definitely you are right in this, that there are many peer groups and support groups for quitting tobacco completely are available in India as well as there are many doctors who are specializing on quitting smoking. So take help from a professional. They would help you in different measures and techniques to assist you in your journey towards quitting tobacco completely. With that, we close this session now. We thank Dr. Aparna Sreevatsa for taking out time and also sharing with us all the wealth and knowledge and the information around this topic today. Thank you so much. We thank Roche for this amazing initiative for clearing the air and making people aware about the link between tobacco use and lung cancer risk. Thank you so much. We would also like to thank our viewers for staying with us till the very end. Thank you.